Are you ever nervous about talking with your doctor? Hi, my name is Tom Jones Pharmacist, and you are on Tom Jones Pharmacist Live. Tonight. Lights, action, camera. 17 lights on. The video just ran. Annie Doodle is in the house. Hello, Annie Doodle.
Hello.
How are you tonight?
I'm doing well. Thanks for asking.
Good. Have you been talking to your doctor lately?
Not lately.
Oh, really? Do you ever get nervous going in and talking to your doctor?
No.
Really? All right, good. I'm asking
You might
the
be
audience.
nervous.
I'm asking the audience, are you nervous about going in and talking to your doctor? That's something that a lot of people have an issue with. And we're going to talk about it tonight. By the way, this program is presented for your benefit. If you have questions, just ask us. Ask us to run a show for you. We'll be more than happy. And it's all about pharmacy. It's all about medical. It's all about questions. It's all about helping you endure this life of ours. All right. Have you ever been nervous about talking to your doctor? That's what we're going to talk about. Now, if you want to receive appropriate medical care, and if you want to learn how to follow through on your doctor's recommendations, you have to have a clear communication path with your doctor, with yourself. And it's essential. But you know what? It's actually easier said than done. Yeah. Have you noticed? The big thing is how long you're actually in the doctor's office when you go. It's your family nurse practitioner. It's your physician assistant. It's your medical doctor. So how long are you in the office? You know what? You probably have noticed that it's getting shorter and shorter and shorter. And we're talking about 2021. You have yourself sitting in your chair, and your doctor in their hands has their computer. And it's all about putting the information into that computer. So you used to walk into the office and you would sit down and you had a communication with your doctor, and he had a pad and he wrote things down in handwriting. But now you will notice that everything from A to Z, it's actually electronic. It's digital. And it's 15 minutes or less. So electronic records have replaced everything. And they've actually replaced some of the discussion that you used to be able to talk face to face, eyeball to eyeball with your physician. On top of that, there's been strong emotions and embarrassment because you sometimes have to talk about personal things, the things that you don't really want to go over, and it's a delicate situation. These things are sometimes disturbing symptoms, and embarrassing sometimes. So as a patient, you can learn to talk to your doctor more efficiently if you write things down and take them with you. So I want you to take these suggestions in choosing your doctor, a doctor that you feel comfortable with, and actually developing that personal relationship again. So, how do you really choose your medical practitioner? Well, check the obvious thing. It's called digital. Check social media. Take a look at your doctor's Facebook, Twitter. All of these social pages that you're actually able to go to now and see and read and learn the personality of your doctor and how they approach life and medicine and everything. Many health professionals actually treat social media as a way to educate their patients, and they answer common questions on social media. So, next, evaluate the evaluations. Yes, it's called evaluate the online ratings of your doctor, of your pediatrician, of your OBGYN, of your internist. All doctors now are rated just like restaurants. So social rating is, and reviews are a thing that actually you're able to look at and become very familiar with, and they're friendly and easy to read. Now, some people have a crutch on their hand when they write an evaluation because they expect the miracle. They expect things that are unrealistic. So always take that in consideration. And the way that a medical practitioner responds to the negative reviews is another way to actually learn their personality and become familiar with how they approach all sorts of different things. You may want to consult the additional sources like referrals from friends and other healthcare professionals. Now, you need to also focus on the team, because doctors, like everybody else, they have their own specialty. They have their own approach to things. They have the items that they really, really care about and focus on. So see how and pay attention to your doctor's interactions with their colleagues as well as yourself. You know, there's studies out there that suggest up to 80% of serious medical errors are caused by miscommunication between caregivers. So if you hear something wrong and you follow the wrong advice, even with the right recommendations, you're in trouble. Next, take action. Most of us want to look for a physician, a medical practitioner who encourages your engagement in the evaluation that you go in for. Do they speak with you respectively? And do they listen and value your input? Because that's all about the way that you communicate with your doctor. So, here's what you need to do. Set priorities. Given how short you're actually in the doctor's office now, ensure you squeeze in the main issues before you leave. You've got to actually have it written down, have it prioritized, and you are going to be able to make that doctor's visit exactly what you want it to be. Focus on your back pain instead of trying to deal with the whole list of experiences that you've experienced. So deal with the whole issue, but focus on what you went into the doctor's office for. Volunteer the information. Your doctor may not want to be asking as much as you want to be giving. So let your doctor know and bring up sensitive subjects like losing weight or like wanting to quit smoking. Share any details that could be relevant to receiving the best treatment that you need to get. And don't forget to ask. Ask questions. More than 65% of medical schools now teach communications, but some practitioners still actually tend to speak in lectures. So asking questions creates a whole discussion, and it clarifies your questions and concerns that you've got actually walking out of the office with. And sum it up. Here's one of the most important parts that you will have all along. restating what your doctor said in an effective way to show whether you really understood what the doctor said. And that way you can actually repeat it back to him or her, and they can repeat it back to you if you've got it kind of wrong. Try giving a quick recap, therefore, before you walk out of the door. And keep a journal. Start a journal if you don't have one. Keep it so it will help you straighten out things when you're dealing with very complex, very complicated medical information and strong emotions. Write down your symptoms and any events you want to talk about. That way there's no question about what's going on. And write. Take notes, jot down what your doctor tells you, use a notepad or your phone. You need to use that cell phone because it's there for a purpose. And some practitioners may even let you record the sessions while you're in the office. And accept uncertainty. Encourage your doctor to be candid by letting them know that you can handle the truth. The truth may hurt you, but you need to be able to avoid unnecessary tests and unnecessary prescriptions that are unlikely to provide clear-cut answers or significant relief. Discuss the risk. Most procedures have risk as well as benefits. Be polite but firm about needing to hear the full story, the full picture. Bring support. And if you're nervous, and a lot of people are, about going to your doctor and going into the office alone, take along someone you trust, like your spouse or a friend, because patient advocates, that's the key phrase. Patient advocates can also facilitate the discussions between you and your medical practitioner. Your employer may have employee assistance programs, or you can contact groups like the American Cancer Society if it's revolving around cancer. Skillful communication can turn you into an engaged patient who makes sound, great health decisions, both for you and for your family. When you're knowledgeable, when you're assertive, and when you're courteous, you help your doctor to provide you with the best quality care that there is out there that's possible for you. All right, Doodle, we have finished tonight's program. How was the evaluation?
It was very, very good. I got some good tips.
Excellent. I hope you did too. As far as the audience, let us know what you want to talk about, want us to talk about. We'll be more than happy to put it on the agenda. My name is Tom Jones, pharmacist, and you have been on Tom Jones Pharmacist Live.